The fact of the matter is the status quo is unacceptable. Obamacare markets are collapsing. Let me just tell you a little story. A woman that I spoke to for the first time on Tuesday, Sherry and Vern Colby from River Falls, Wisconsin, contacted our office, and I called her up, and she conveyed her story to me. Has some pre-existing conditions. In 2014, they signed up for Obamacare. I won't go through all the troubles they had signing up, paid their premiums, sent in their check stubs to make sure they qualified for the subsidies. Did their taxes in March of 2015, got the bad news that they made too much money and had to pay $15,000 back to the IRS. Now, the IRS isn't real kind about being real forgiving about it, so in order to pay that $15,000 back, because, again, they made too much money, they first pretty well depleted their 401k, then they had to sell their home that they intend to live in for the rest of their life so they wouldn't lose their home. I mean, think about that. Now, Sherry and Vern are the forgotten men and women, the same folks that Bill Clinton was talking about, the ones that are busting it. Vern works 60 or 70 hours a week driving milk trucks. Sherry works 30 hours a week as a florist. They're busting it. They're working those hours. They've seen their premiums double or more. Their coverage cut in half. They depleted their 401. They lost their house. That's why the status quo is not acceptable. And I'm sorry, the skinny bill of the Senate doesn't even come close to honoring our promise of repealing Obamacare, those market reforms that have increased their premiums, and nothing we're doing, virtually nothing we're doing in any of these bills and the proposals are addressing the challenges, the problems, the damage done to people like Sherry and Vern. And so all we're asking leadership, and this is a very simple request, just give us the assurance that whatever we pass tonight will go to conference. And so the good ideas of people like Senator Lindsey Graham and Senator Cassidy here can get scored, can have a chance to be argued, and hopefully can replace Obamacare with something that actually works for folks like Sherry and Vern.